As you can see from my title slide, here are 3 examples of individuals who once suffered from transgender belief and then desisted from that belief. You will all have the privilege of hearing from my good friend Walt Heyer later in the program. So from your left to right, we have Walt Heyer, who lived several years as impersonating a woman. In the center, we have Kira Bell, a very brave young woman from the UK who came out and sued the Tavistock Gender Clinic in the UK. She attempted to transition from female to male. That's a physical impossibility. At age 16, with hormones and a double mastectomy. By the time she was in her early 20s, she realized that biologically she was still a woman and desisted. Thanks to her, largely thanks to her coming out in that fashion, the UK's only gender clinic, the Tavistock Clinic, has been shut down. And the final woman to the right of your screen, you've heard about her, Laura Perry, did live several years on hormones and with surgeries as a male, and eventually was able to re-embrace her body and her true female sex. So we are not dealing with any biological or medical condition when we talk about transgenderism. We are speaking about belief. And so let's get on to what the science really tells us about our bodies and about sex. In all the life sciences, whether you're speaking about plants, animals, or any other genus, sex is defined according to how an organism is designed to function during the reproductive act. Males are defined as those organisms that donate genetic material during the reproductive act. Females are defined as those organisms that receive genetic material during the reproductive act. And the individual who, Dr. Colin Wright, pointed this out in a very early blog post of his, and I want to mention his name as Dr. Piercy did earlier. Dr. Colin Wright is an evolutionary biologist. He self-identifies as an atheist, and he is not by any means conservative. He is a genuine scientist. This is what the science says about sex. Only 2 choices, male or female. What determines sex? Sex is determined by sex-determining genes. The sex-determining genes, most of them, are located on our sex chromosomes. The X and Y chromosomes are your sex chromosomes, but it is the genes on those chromosomes that determine whether you will be male or female. And this is set at fertilization. Because sex is determined by genes, you cannot change sex. So gender transition, sex transition is a physical impossibility. Drugs and hormones do not change your genetics. Drugs and hormones can change your appearance. It can modify your appearance. It can even modify your physiology slightly to different degrees, but cannot change your sex. So just as you can have people cross-dress, and colloquially, we say, oh yeah, that's drag. Hormones, drugs, and mutilating surgeries do not change your genetics. They are essentially chemical and surgical drag. We are altering appearance. We are not altering the reality of your sex. So what about intersex? I'm going to step back before I answer that question. Just as an analogy, when I was in medical school, I had a mentor who was an endocrinologist. So endocrinologists treat disorders of the hormone system. Diabetes is a very common condition in pediatrics, and one of my med student colleagues was presenting a case and said, Mrs. So-and-so is a diabetic, and he said, whoa, 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 stop right there. We don't have diabetics. How dare you define a person by his or her disease? We have people with diabetes. This is how we need to think about intersex. Intersex, the proper term is disorders of sex development. We have people who have disorders of sex development. We have people with intersex conditions. And these are conditions that are present before birth. They are genetic, and they impact the reproductive system and our capacity to be fertile. Every single disorder of sex development is associated with reduced fertility. So they are disorders. They are thankfully extremely rare, thankfully. By no means, and I don't want to diminish, they are indeed tragedies as well. However, they are medical conditions that do require a medical team to come together with the family and the affected individuals to help them heal and move forward. Fortunately, these, and there's a large number of disorders of sex development, they still only occur in 2 out of 10,000 births. This is not to diminish the suffering of those individuals who have the conditions, but it's important to point out that this is entirely separate from transgender belief, and sex is not a spectrum. There's still only male or female. As we heard earlier too, there never used to be this division between gender and sex. And it's my belief that we should really, when we're speaking of transgenderism, focus on the fact that we are talking here not about this thing called gender dysphoria, but actual body hatred. If we can reframe the conversation around, we are speaking about embracing bodies rather than rejecting them, that will get us a lot further down the line to actually reaching people, embracing those who truly are suffering. My slide speaks about in the 1950s, prior to the 1950s, gender was a term that was used only to refer to grammar. In the Romance languages, there were modifiers that are male, or masculine, or feminine. If I have a friend who's male in Spanish, that would be amigo. I have a friend who's female, I'd refer to her as amiga. It was a grammatical term, gender was. But in the 50s and 60s, we had the rise of psychologists and surgeons who wanted to justify their transsexual surgeries. And John Money was the first to take that word gender and redefine it as an internal sexed identity that could be different from a person's biological sex. So I have this slide just to point out it was really just pulled out of the air to justify mutilating surgeries. Today, in the American Psychiatric Association's diagnostic manual, the DSM 5th edition or DSM-5, they define gender as a lived role of male or female. But even here, they point out, so even the other side, so to speak, points out that this is not something purely biological or innate and unchangeable, because they claim that, yeah, gender has to do with cultural things and psychological factors. Gender identity, the DSM-5, the American Psychiatric Association, defines as a category of social identity determined by the interaction of cultural, psychological, and biological factors. Well, if it's an interaction of multiple factors, 2/3 of which, by their definition, are not innately biological, then we should be able to help people embrace their bodies. Gender dysphoria, again, that is the term that the American Psychiatric Association now uses. It used to be called gender identity disorder, but the small team of psychiatrists who came together to revise the 5th edition said, well, we don't like that identity disorder in there because it's promoting stigma. So they changed the name and as well as the definition. With gender dysphoria, dysphoria just means emotional upset. With this definition, with this new category, they said the problem is only the emotional upset and if it's impairing social function. It's not a problem that the person rejects their physical body or has an idea opposite to their physical body. Only the emotional upset or lack of social function is the problem. So if we can get them happy and functioning fine in society, sure, those surgeries and those wrong sex hormones, yeah, that's okay. And if we have it in this DSM-5, well, now insurance companies will pay for it. So that is what went on. And we are continuing to see in the medical field, we are continuing to see the language morph. The World Health Organization publishes an ICD book, which was in the 10th edition. They just came out with an 11th edition, and they have now coined the term gender incongruence. And they took it right out of the psychiatric pages, and they moved it to a new section on sexual health. So the World Health Organization, too, is all about normalizing this. So again, the question was, how can something that is so anti-common sense be taking ground? Because it's a top-down revolution. Transgender is defined in the DSM-5, again, the American Psychiatric Association, as a broad spectrum of individuals who transiently or persistently identify with a gender different from that associated with the individual's biological sex. Now, how can you have it? The reason I put this here is they have it both ways. On the one hand, we are always hearing, you can't change someone's gender identity. And yet, in their own psychiatric Bible, they say, yeah, it may be temporary or it may be long-term. So they themselves are contradicting one another. And it's totally made up. I mean, actually, Tumblr at one point had 112 genders that you could identify with. I'm sure it's higher now because that's from a few years back. And transsexual is the term that is falling out of usage. So what do we know about children and gender identity? The cognitive theory of gender identity development put forth by Lawrence Kohlberg in the early 70s essentially comes in 3 stages. So age 3, age 5, age 7. Most children by age 3 know whether or not they are a boy or a girl. So typically by age 3, a child knows and identifies their biological sex. Age 5, that is how old most children need to be to realize, oh yeah, boys grow into men, girls grow into women. But there are many kids who it's not until age 7 do they understand that sex is permanent. Not until age 7 do most kids understand if a man puts on a dress, that doesn't make him a woman. So this is why it is psychological abuse to take your little toddlers or preschoolers to drag queen story hours. The indoctrination is starting the moment you put your child in front of the TV, as you saw. I mean, Disney, Blue's Clues, nothing is safe. The indoctrination is everywhere. Preschools, there are well-meaning but brainwash teachers reading all kinds of gender-bending books to your preschool kids. It really is at the point that if you want to protect your kids, you need to homeschool. I mean, I think we're seriously at that point. So what is, for the rest of my talk, I want to base the rest of my talk moving forward on debunking the current pediatric narrative that's being put forth from the American Academy of Pediatrics, the American Medical Association, and it's being taught in virtually every single medical school across the country. The claim is children who believe they're transgender, and by the way, you can know this was great. I don't know how many of you saw this. The Boston Children's Hospital apparently stated that kids can know they're transgender before birth. And someone, I don't know who, someone put a TikTok out, or meme, which was amazing, saying, so let's get this straight, Boston Children's Hospital. Babies aren't babies before birth, but they can know that they're transgender before they're babies? Yeah. I wish I could take credit. I mean, I don't know who put that meme out, but it was amazing. So, we are really at the height of anti-science. So here's the narrative being taught in every single medical school. Children who believe they are transgender are born with a brain on a different page from their body. And this is innate and unchangeable, number one. Number two, these children are not mentally ill. How dare you suggest that? Number three, counseling to help a child embrace their physical bodies is universally harmful and would never work. And number four, children who believe they are transgender will kill themselves unless, mom and dad, you start allowing them to cross-dress, change their names, make sure everyone else treats them like the opposite sex, and you put them on blockers, wrong sex hormones, et cetera, et cetera. So these are the 4 points I want to review from the science. All right. Here's the politics of brain studies, because when they put forth this claim, hey, we have scientific proof that these kids' brains are just not on the same page as their bodies. And the proof comes in the form of functional MRI studies. So here's the politics of brain studies. Again, an analogy. Most all of us are familiar with eating disorders and anorexia nervosa. Fact, for decades, we have known that there are brain differences between young women and men with anorexia nervosa and their peers who do not have the eating disorder. So, y'all got the memo about how we have obese brains trapped in skinny bodies, right? Did y'all get that memo? No. It wasn't suggested once. No. Why? We'll get there. But on the issue of transgender, where we have far fewer brain studies, far lesser quality, and the studies we do have, they don't replicate one another, all right? And yet we are told, oh, these images prove that some girls' brains are trapped in boys' bodies and vice versa. Or alternatively, the other thing we are told in journals is that, hey, you know what? There's no such thing. Everyone just has a mosaic brain. All right, so what's going on? What's going on? The reason the researchers with eating disorders and many other fields, for example, we happen to know that there are brain differences between musicians and non-musicians. We can look and demonstrate brain differences between Buddhist monks and individuals who do not meditate or pray as much, right? So what is happening? Because we understand in those non-political issues that the brain is like a muscle. And there is a phenomenon called neuroplasticity. As we exercise different regions of our brains through activities, through behavior, through relationships, those different areas of the brain actually change not only physically in appearance, but also in their biochemical functioning. So for that reason, and what we know for a fact, from the beginning, babies are born, and from the beginning, that maternal infant gaze impacts their brain development. Behavior, thinking, relationships, everything alters our brain structure and function. Neuroplasticity is a fact. Therefore, the transgender brain studies do not indicate causation in the sense of, oh, the brain makes them transgender. No, it more likely reflects that transgender identification alters the appearance of the brain. And this is a very non-controversial statement, as I said, because we know it is true in all human behavior. We also know from embryonic and fetal development that no baby is born with the wrong brain. From fertilization, right, you've got your sex-determining genes that come together, and every single cell in an embryo, every single cell with a nucleus in the embryo has the same sex chromosomes, either XY with those sex-determining genes or XX. So all the male embryos have genetically different tissue in every organ, and the brain is part of the body, genetically different from female brain tissue from conception. Furthermore, when our male embryos grow to about 8 weeks gestation, their testicles are developed enough that they are now secreting testosterone. Little girl babies, little girl embryos, fetuses at 8 weeks gestation do not have testicles. They are not generating testosterone the way the male unborn babies are. The male unborn babies have male genetic tissue that is being extra masculinized now by their own testosterone. So it is physically and scientifically impossible to be born with a brain on a different page from your body. So let's take on the innate and immutable claim from the point of twin studies. And again, we're looking at the politics of twin studies, again with anorexia nervosa. Identical twins at conception, they come from the same initial sperm and egg. So they have 100%, they start out 100% with the same genetics. So if you are dealing with a condition such as, for example, skin color that is determined only by genetics, well, at birth, both identical twins have the same skin color 100% of the time, for example, okay? So the closer you are, if you're looking at a trait between identical twins, the closer you are to 100%, the more that trait is caused by genes. So in the case of eating disorders, if one identical twin has anorexia, and this is a compilation of several studies, if one identical twin has anorexia, there is a 44% to 70% chance that the other identical twin also has anorexia. So 70% is still far from 100%. It tells us that this is not due to genetics alone. Genes probably play a role, but it's not innate and immutable because you're still far from 100%. Well, how likely is it if you have one transgender believing identical twin that the other identical twin will also be transgender believing? The chance is no greater than 28%. That is a trait with far less genetic influence than anorexia nervosa. Do we ever hear that, hey, you know what, eating disorders, oh my gosh, innate and immutable, it's hopeless? No, you don't hear that. But transgender, oh my gosh, it's innate, you bigot. No, the science says it has far less genetic influence than your eating disorders. Genes do not determine either one. There's hope. And this is true about all behavioral traits. Genes influence behavior. They do not hardwire a person to think, feel, or behave in a particular way. Nevertheless, with those lies being put forth, our American Academy of Pediatrics, the American Medical Association, World Health Association, well, we must socially transition all transgender believing children. It's safe and necessary, they claim. Number 2 claim, we must, to prevent suicide and decrease anxiety, prevent depression, put these young children between the ages of 8 and 12 on puberty blockers. We must block their puberty. Then perhaps, even as young as age 8, certainly before 13, we're going to put them on what I call wrong sex hormones. Because they are. You're taking boys who at puberty, their testosterone should be surging, and instead you're blocking their testosterone and putting the boys on estrogen. Or you're taking girls who at puberty should have a surge in estrogen. You're blocking their natural estrogen and putting them on testosterone. And then number 4, in the beginning, years ago, we're not going to recommend surgeries for anyone under 18. For several years now, we have girls as young as 13 across America who are having their healthy breasts removed. So this is what is going on. The American Academy of Pediatrics claims that it is fully scientific and backed by the evidence. Dr. James Cantor, who is himself a very liberal psychologist and gender identity expert, was extremely shocked when the American Academy of Pediatrics came out and said every child must go through this routine if they are trans believing. So he pulled their policy and he pulled every single citation and then published his own article in the peer-reviewed literature and said the AAP has lied. Every single reference in the AAP statement contradicts their recommendation. And, not surprisingly, the transgender socially affirmed kids are not okay. The first 2 studies I have up on this slide are 2 studies that are most frequently used to prove that affirming kids as the opposite sex is good for them. My colleague, Dr. Walter Shum, is a psychologist with Kansas State University. He's semi-retired, he's tenured and semi-retired, so that's why he can publish the truth. So Dr. Shum was intrigued by these studies. He reviewed them. Both studies are by the same data set, based on the same data set. And he reached out to Dr. Christina Olson, one of the lead authors, and he said, I'm puzzled by some of what you report here. I think you must have surely calculated a couple other statistics to go along with this data set that you did not publish. And she said, oh, yes, we did. And he said, well, would you be willing to share your entire data set with me? And she did. She sent him her data set. And he completely reanalyzed it. He included the data she left out and corrected a few statistical errors and came to the exact opposite conclusion, that when you correct her errors, include the entire data set, every child who, the children who are affirmed as the opposite sex have significantly lower self-worth, and their self-esteem got worse the longer they were affirmed as the wrong sex. Of course, so he was able to publish his results, his analysis and results, in the Lineker Quarterly, which is it is a peer-reviewed medical journal of the Catholic Medical Association. Again, now why not? Why wouldn't he go to a secular journal? Well, he did. He did submit to the secular journals, but the secular journals are largely bought and paid for by the pharmaceutical companies who are profiting tremendously from the transgender movement. So nevertheless, February 2020, Lineker Quarterly, it is searchable and identifiable, Walter Shum. What we do know, there are now at least 5 studies to demonstrate that social affirmation, so-called, and pubertal suppression leads to 100% of the kids identifying as transgender. Stealing puberty, and this is the message that we need to get out. Puberty blockers steal puberty. Stealing puberty robs children of the developmental stage during which most will change their minds. Blocking puberty is not a pause, it's stealing. It's stealing from children. This is also very interesting. In the Endocrine Society in 2017 published this, broke down the social affirmation as well as the puberty blocking and the hormones into 22 separate guidelines. And then reported, 20 out of these 22 affirming, transgender affirming guidelines for kids are based on very low to low scientific evidence. There are only 2 of these guidelines based on moderately strong evidence. And those 2 guidelines are the ones that recommend watching for harm. The Endocrine Society guidelines, and these guidelines that they've analyzed are the ones put forth by the World Professional Association of Transgender Health, WPATH. Whereas WPATH refers to them as standards of care, in 2017, the Endocrine Society was honest enough to say, these are not standards of care. This is what's happening, but they don't qualify as standards of care. They have a disclaimer. But, mainstream media doesn't talk about that. So puberty is a critical, normal and critical developmental stage. When you block puberty, you are actually inducing a disease. The number 1 drug in America being used to block puberty is Lupron. And Lupron, still in several states, is the drug used to chemically castrate sex offenders. So what are we doing? This is a medical slide about sexual development. So when you put a child on Lupron, you are freezing their sexual development, but it also does more than that. So, as I said, when you block puberty, the absence of normal puberty is a disease, and there's actually a name for it, because this disorder can occur naturally. Hypogonadotropic hypogonadism. You don't have to remember the name. I just want to make the point that it's the absence of puberty that is a disease. When you put the kids on the blockers, you're putting girls into a menopausal state. So yes, you're blocking her breast development, but as she grows older, even if they stay on these drugs for only a few years, we are still impacting their ability to have normal sexual function. While they're on the drug, her ovaries are not maturing. She is infertile. She's not developing healthy eggs. You are disrupting bone development, normal bone density. And we're disrupting normal brain development because the sex hormones that are supposed to be coming in organize the development of the brain. So there are similarities also with the boys. You're stunting their sexual, their penile growth, testicular development, no broad shoulders, no deepening of the voice, development of body hair, etc. As adults, because their genitalia are not developing normally, as adults, they will not have normal sexual function. Once you combine the Lupron with wrong sex hormones, that temporary infertility becomes permanent sterility. The bottom about disrupting normal brain development. Lupron has FDA-approved usages in adults. For example, in men, Lupron treats prostate cancer, and it is acknowledged that men who are on Lupron for prostate cancer suffer memory loss. Women may be put on Lupron to treat a condition called endometriosis. Similarly, it can also impair their memory. Okay, so we're putting healthy kids on this. This is a hard concept for people to understand because they'll say, but Dr. Cretella, if we put a child on the puberty blocker and then take them off a couple months, a couple years after, eventually their pituitary gland's going to kick in and they'll have puberty again. Stop. You have robbed them of I don't care if it's 2 weeks, 2 months, 2 years, whatever. You are robbing them of normal pubertal development. You cannot give that back to them. You don't have a time machine. That is a crime. In the science, scientifically speaking, there are 3 things that we can say. Is that, scientifically speaking, the vast majority of the kids stay on these puberty blockers for years. Their normal bone density is lost. Even if they come off early, bone density is lost, and it cannot be given back to them. Psychosocial milestones are lost. Sex steroid organization of the brain is impaired. You just can't give it back to them. But, we're told, the blockers decrease suicide risk. It's proven. Dr. Jack Turbin is one of the most vocal proponents of this myth. This was one of the first studies he came out with in 2020, claiming to prove that puberty blockers reduce suicide. Now, I have colleagues who basically tore his paper apart because it is just so flawed from a methodological standpoint. And then it was with the American College of Pediatricians, Doctors Field and Trumbull, and I said, guys, look at table 3. His own table 3 in this study showed that youth who were on the puberty blockers had double the rates of serious suicide attempts, resulting in hospitalization. He didn't even see that in his own table. So my 2 colleagues added that to their critique, and Jack Turbin's response was, your critique hasn't been peer reviewed. But you don't even need to look at their own studies to pull out Lupron's package insert. Lupron's package insert warns all physicians that our drug can cause emotional instability. And it doesn't only warn about emotional instability, it warns, watch your patients for worsening of their own psychiatric illness or for the development of new psychiatric illness. So from the package insert, we know emotional ability, mood changes, nervousness, anxiety, agitation. Anxiety, agitation, depression, we don't see that in people considering suicide, do we? Yeah. Again, referencing the Tavistock Gender Clinic in the UK, in 2019, one of their mental health workers turned whistleblowers, Dr. Michael Biggs, he found a report that had been suppressed by the clinic that showed, even in the UK, children who were on blockers reported greater self-harm than those who were off them, and the girls who were on the blockers exhibited more behavioral and emotional problems and greater body dissatisfaction being on the blockers. So he exposed this. He was one of their whistleblowers. It is true that youth who have a transgender belief do have higher rates of suicidal thoughts and suicide attempts. But what we need to understand as parents, teachers, clinicians, children and young adults with transgender belief are at the same risk of suicide as any other child or young adult in a high-risk group. And this is that Dr. Biggs conducted a study to demonstrate this. He said if you have transgender belief, your suicide risk is increased by a factor of 13. Children, young adults with anorexia, their suicide risk is increased by a factor of 18. Those who are depressed, depression, but he separated out, so he was looking just depression. They have an increased suicide risk by a factor of 20. Bottom line, we take threats of suicide seriously regardless of who they are coming from. But those with transgender belief are no more or less likely than any other at-risk individual. And that's very important to understand. Is suicide inevitable unless we have our kids cross-dress, change their names, and put them on these dangerous drugs? Well, the obvious answer is no, and you don't have to take my word for it. The red textbook in the slide is put out by the American Psychological Association. It is their handbook on sexuality and psychology. I believe this came out, well, actually each of these were in 2013. So at that time, that textbook admitted over 75% of gender-confused children will resolve by adulthood. The purple textbook is the American Psychiatric Association's Bible, your Diagnostic and Statistical Manual, 5th edition. They broke it down further using their data. One can calculate, and I think it's on page 451, as many as 88% of gender-confused girls and as many as 98% of gender-confused boys will resolve by adulthood. The third reference there I have of roughly 60 to 90% of gender-confused children desisting by adulthood. That is by Dr. James Cantor. Again, he published a review of 11 studies, and that is what he found, as many as 90% of gender-confused children desisting by adulthood. So what's important to understand is that these numbers were calculated in studies at a time when we did not have social propaganda that we have now. So without social indoctrination, drugs, or surgeries, most kids get better before or after natural puberty. That's the bottom line. We also, I didn't have it on the slide, there are 16 case reports and case series in the psychiatric literature to demonstrate that teens and adults, through talk therapy alone, can come to embrace their bodies. So there are 16 psychological studies, case series, case reports, to demonstrate that counseling, talk therapy alone, can treat underlying traumas, underlying conditions, and help people embrace their bodies. The final word I want to say about suicide is that there's no other medical condition, there's no other case in which a child or an adult would come to me as a doctor and say, I want to kill myself, that I as a doctor would then give them the prescription pad and say, all right, tell me what to do. Go ahead, write your prescription. No, we recognize in every other case scenario, we recognize suicide, the threat of suicide, as a cry for help. As a cry for help. And we don't blame the patient either. We don't blame them like, oh my God, what's wrong with you? No, we embrace them compassionately, and we try to help them both with psychotherapy. It may be individual counseling, it may be family counseling, both, and where indicated, antidepressants and other supplemental medications, not hormones. Hormones have no place in the treatment of depression, anxiety, or suicide. 90% of all suicide victims carry a diagnosis of mental illness, and there is no evidence that children or young adults who are transgender believing are any different. So prevention of suicide for this group of individuals is the same as prevention of suicide for anyone else. And what's most recently, number 4, the Heritage Foundation conducted a study looking at states that allow children and young adults to go through these interventions without parental consent, and compared them to states that have a very strict parental rights protocol. States that do not require parental consent have higher rates of teen suicide. So we've talked about the dangers of the puberty blockers. What about the dangers of wrong sex hormones? Okay, and again, infertility is huge because we're talking about children. When you take a child and block them at early puberty, they never develop healthy sperm or healthy eggs. And you combine that now with the wrong sex hormones, you are permanently sterile. So that's the biggest factor, side effect. But in addition, we are diseasing our children. So males on oral estrogen, increased risk MI is for heart attack, myocardial infarction. That's your technical term for heart attacks. So heart attacks, blood clots, thromboembolism, 5 times the risk of blood clots. Strokes, twice the risk. Gallstones, hypertriglyceridemia, that's your fats going off the wall. Breast cancer in men, gynecomastia is breast enlargement. Females on testosterone, increased risk of heart attacks and cardiovascular, again, heart attacks, deaths. Erythrocytosis, that is basically you're producing too many blood cells, a thickening of the blood. Severe liver dysfunction, high blood pressure, that's what hypertension is. Breast cancer, uterine ovarian cancers. Hirsutism is just increased hair, which women who go on testosterone and want to desist and come off will always have a 5 o'clock shadow. They will always have an enlarged Adam's apple, and they will always have a deepened masculine voice. So those things are not reversible. To give you an idea, this is from my colleague, Dr. Mike Laidlaw, who designed this slide. The testosterone that we are putting our daughters on is greater than the testosterone that is pumped out by some cancerous tumors. So what you see on this slide, the blue is the normal amount of testosterone females have in their body. Polycystic ovary syndrome is a common disorder in women, and that increases women's testosterone per the gray bar. An endocrine tumor, that's what's represented by the red bar, and what we give our daughters when we claim to be transitioning them to men is the orange bar. So that just demonstrates how abnormal this is. It's as abnormal as a cancerous tumor. What kinds of wrong sex surgeries are being performed on teenagers across our country? Double mastectomies as young as age 13, hysterectomies as young as age 16, something called phalloplasty, creation of, you cannot create a penis. I mean, it is physically impossible to change a person's sex. So I call it a faux appendage, right? I mean, it's something, phalloplasty. And what's horrible is they end up removing skin from the forearm to construct this thing. In males, there is feminizing facial surgery, mutilating feminizing facial surgery, Adam's apple shaving, of course, castration, removal of the penis, and creation of a wound to simulate a vagina, creation of a pouch, and it has to be continually stretched. Yeah, I mean, for lack of, this is cruel. It's cruel and inhumane. So when you strip away the euphemisms when you strip away the euphemisms, what we are talking about is the sterilization of emotionally troubled young people, right? Yes, these are young people who are emotionally troubled. We are not going to minimize their sorrow. That's real. But what we are doing is mutilating and sterilizing them chemically and surgically. And that's criminal. What we know from long-term studies, 30 years, this is a 30-year study of adults, and this was done in Sweden, which is, you don't get more LGBT affirming than Sweden. What this dramatic diagram shows, the dashed lines, the top dashed line is, that's looking at your females. It's kind of hard to see. It's supposed to be a light gray. But the top dashed line, which is stepping down, those are your females who have been put on testosterone and undergone surgery. And it's showing that they die at dramatically greater levels than the females at the top line. So the very top solid line, that is the natural length of life and health of women. The second line, which is dark black, those are natural men who have not undergone any hormones or surgical transition. The dashed lines, these are your adults who have undergone transition surgeries and hormones. So we are not helping them. We are not helping them by any stretch of the imagination. What about the claim that children who are transgender believing are not mentally ill? We had two early studies from 2015 and 2018 that demonstrated that youth with mental illness, with severe depression, severe anxiety, were overrepresented among those who were coming out with transgender belief. Since then, in 2018, there was a huge Kaiser Permanente study which found that, and they identified transgender believing youth. They found that those youth, they had 7 times higher the number of psychological disorders, 22 to 44 times higher psychological hospitalizations, self-harm, suicidal ideation, hugely inflated compared to those who were non-transgender believing. And all of these issues were present before these youth ever had any gender nonconformity, before they ever claimed to have transgender belief. So there's no question that trauma and other underlying conditions cause at least some, or many, I would say, cause many youth and young adults to feel estranged from their bodies and to believe that they are the opposite sex. This is an even more recent study that came out in 2021 looking specifically at trauma. And what's huge here is that 98% of all the youth had experienced traumatic events before coming out as trans. And they had an average of 5 traumas per child, and mostly within the family. This is not always the case. This is not always the case. Sometimes it is a matter of misperception of normal family events. And I've shared this story about a patient I had in 2010. He was a little boy at age 5. The parents were concerned because now he was saying he was a girl. But in looking over the story, at age 3, he seemed to understand. At age 3, he knew he was a boy. But he had a little sister who was born then, and she had significant special needs. So all of a sudden, he was 3-year-old, call him Johnny. 3-year-old Johnny went from being the center of his parents' universe to being, relegated to like almost, from in his mind, nothing. And It only came out after several sessions in family therapy. Mommy, Daddy, you don't love me when I'm a boy. Now, these parents they were good parents. They didn't do anything wrong, but it's just an example of how a young child's mind can misinterpret and misinternalize things. But with individual and family therapy, the source can be uncovered, and working together, within a year, yeah, he knew he was a boy again, and he understood, Mommy and Daddy do love me. Nevertheless, trauma and mental illness absolutely do play a role for many, and we are doing a grave disservice to these suffering individuals when we say, oh yeah, we're just going to put you on wrong sex hormones and mutilate your body. It's crazy. We need to get back. This is my good friend, Dr. Paul McHugh, who is considered to be perhaps one of the most important psychiatrists of the last 50 years. Dr. Paul McHugh is perhaps the first to have said, look, we need to put this transgender belief back where it belongs, meaning understanding that it is a disorder on the same level, a disorder of body perception. We have eating disorders in which, with anorexia nervosa, skinny people think they're obese. We have body dysmorphic disorder in which people look at themselves and believe they're horribly disfigured when they are not. We have body integrity identity disorder in which able-bodied people believe they are actually amputees or actually otherwise disabled, and they search out for doctors who will sever their spines or amputate their body parts. Transgender belief is in this realm, is what Dr. McHugh was saying. And I think if you want to destigmatize, help people understand, you know what, there's something underneath it. This is the psyche or the mind's way of trying to heal the pain. We want to help people heal their pain in a way that also embraces the goodness of the physical world. And Dr. McHugh has also shared that underneath, and that's what this slide is about, he says underneath that transgender belief can be an attachment disorder. It could be bullying, internalized, even internalized homophobia. It is easier, and we've had kids, there are studies that have documented this. There are children and teenagers who've come out and said, it is cool to come out as trans. It is not cool to come out as LGB. I know this isn't on we won't. Suffice it to say, when it comes to innate and immutable, even LGB, which is a sexual identity, for the same reasons I pointed out with transgender, LGB is also not innate and not immutable. However, when someone identifies as LGB, at least they are not going to be put on the chemical mutilation train. But anyway, suffice it to say, there are a number of conditions that are treatable that could be triggering a transgender belief. And perhaps the greatest contributor to what our teens are facing today is social contagion and indoctrination. This slide is demonstrating that in under 10 years in the UK, the red line shows the number of female girls referred to the Tavistock Clinic in the UK in less than 10 years, a 4,000% increase. Among the boys, it was maybe a 2,000% increase. That's not organic. That is social. More recently, it was reported in Reuters, there was a survey among the US, and in 3 years, let me get this straight. I think it was saying in the last 5 years in the US, Identification with transgender belief or transgender identity has tripled. This is going on in all the Western countries, and this is not organic. Again, we have indoctrination from youth literature, public schools, private schools, the internet, your drag queen story hours in all public libraries, and the TV. The slide in the center is powerful in that the blue line represents the advent of Facebook, the green line, the advent of Tumblr, and the red line, the advent of Instagram. On the horizontal, your jagged lines, your jagged gray line, that is the percentage of girls identifying as trans. And you can see the dramatic rise with the advent of Facebook, Tumblr, Instagram. The boy, the male line, is your black solid line on that horizontal axis. And, we get the question, well, what is it? Why girls? Why are girls more impacted by this? And again, it's the best that we can explain this is that one of those sexual differences, just as eating disorders can be found in boys and girls, it appears that females, girls, are more prone to messages in the media, etc., about when it comes to body hatred and self-loathing. And it is our belief there's significant overlap between eating disorders and transgender belief, that if we did not have all of the propaganda and indoctrination around transgenderism, most of these females would be dealing just with eating disorders. So we believe it's a sexual difference in terms of vulnerability to social media, to messaging, etc., about the body. So what does cause transgender belief? The same number of factors. It's always an interaction. It's an interaction of factors. Our vulnerability, right? Our biology contributes to our personality. So when I say vulnerability, sure, genes, biology, think personality traits, plus environment. And what is environment? It's family, it's friends, it's everything else, everything that's not biological. It's messaging, and finally, plus agency. What's agency? It's free will choices we make. So vulnerability, we're made out of biology, our bodies, our hormones, that stuff, our genes matters, but it's not that alone. It's biology plus environment plus choices. Choices like what? Choices like, do I join an LGBT, gay straight alliance club? Do I click on that link that takes me to a porn site and then I become addicted to porn? All of these different things can contribute to taking you down the path of a transgender belief. From science, we do know that social reinforcement and contagion absolutely makes a difference. We do know from back when it was allowed to be discussed that parent psychopathology and family dynamics can play a role. Adverse childhood events can play a role. We know that youth and young adults with autism are more prone to getting caught up in transgender belief. But the bottom line is that authentic science and faith, so there's no contradiction, authentic science and those faith systems that teach us about the goodness of the body combine, they cooperate to heal minds, embrace bodies, and save lives. And that's the message we need to get across. Heal minds, embrace bodies, and save lives. Thank you.
Okay, so we'll take a couple questions. And this could be for either of the speakers or maybe both. I'm just wondering what is next.
What is next? So I think Dr. Piercy really hit the nail on the head with her transhumanism slide. Transgenderism is transhumanism in a way, because it is, you have the body mind, the physical spiritual divide, and that's what you need for transhumanism. And we are already mutilating the body. We're getting, so human nature is male or female. So transgenderism, by denying male or female and moving body parts around, is sort of transhumanism 101, right there already at the foundation. And in fact, Dr. Piercy had Martine Rothblatt, am I saying the last name right? Is in fact a huge transhumanist and goes around, is also transgender. And if you go to the internet and were to Google the transgender transhumanist connection, you will come up with some very good pieces. Unfortunately, but that's the next thing that's sort of already here.
Thank you for your presentation. I have a question for myself. Specifically, I'm a semi-retired psychiatrist, and I've watched with dismay and disappointment my own profession, how Dr. McHugh's been silenced professionally and in the media. And I'm, again, impressed by the data you're presenting, but for me, like individual, like, what can I do? It seems there's this juggernaut of Supreme Court decisions, other well-funded agenda to silence this movement. This auditorium should be packed full. It's only half full. I mean, I'm like just appalled. I see this toxic movement. It's like, but what can I do? I don't have a big platform. I'm kind of an introvert, not a speaker like yourself. So like within my own domain as a medical professional, what can I do?
I think we have to start small. In the sphere of where we have our influence, family, friends, in fact, Amber, there you are. If I have a handout with different resources that I could get to you, that you could make available on your website, for example, so that anyone could access it. We need to educate family and friends about the truth so that we can protect the children in our own sphere and go out. There used to be an Agree shampoo commercial that was wonderful. And I don't know, I told two people and they told two people, and so not to minimize it, but because, as you say, I talk about it being a top-down tyranny or a top-down revolution. Looking at it that way, it's, oh my gosh, what can I do? You can talk to your friends, you can talk to your family, your own children, your own grandchildren, your neighbors. You can get educated and share resources. Growing up, I was always a big proponent of public education, but now, as I said earlier, I am very much in favor of, parents are the primary educators of their children. We need to take that right back. We need to take that right back. And in any faith communities you can speak to, myself, I'm speaking out more within churches, because there's I myself am Catholic. But within the Christian, so I've got a finger on the pulse of the Christian community, and there's a lot of confusion. So wherever you can share in faith communities, that's going to help, especially as a psychiatrist who practiced at a time when the field still acknowledged that normal means your brain and mind accept physical reality. right? Like normal means I look at the chair and I see it's a chair, and we don't have that anymore. So you have authority. You do have authority. Don't underestimate your influence. We have to embolden the grassroots to protect the children we can, and to go out and spread the word about the truth. I guess, if Jesus could do it with 12, I don't know. I think we really, yeah. There's always hope. We cannot lose hope.
You just mentioned Jesus, and I just see that as, that's huge, because we're made in his image and likeness, and we need to understand this is demonic attack on human life. Satan hates babies. He hates the family.
Right. And I think it's important even to get that message out in secular, and we're not in church. It's important to get it out in secular settings. This transgender belief is not about science. It really is about religion. And as Dr. Piercy pointed out, pagan Gnosticism. So what is, a bunch of people can be in the audience, I don't want to hear about Jesus, I don't care. All right, I'm not asking you to convert, but I do want you to understand the worldviews. These are two religious worldviews that are competing here. It's not about science. It really is about Gnostic paganism versus Christian worldview, because Christian worldview undergirds Western civilization. That's history. That's historical fact. And that is why it's like, how can we be in denial of Bio 101? You can be in denial of Biology 101 because this is a religious battle. This is religion. And that's what the vast majority of people don't understand. So it is critical to talk about, yes.
Dr. Cretella, thank you. This information is so powerful, but you touched on something too that I would like you to address a little more thoroughly. Is this whole redefinition of terms and how the language is being changed and twisted, and that in turn is changing culture.
Right.
Because some of the greatest cultural Marxists, right? If you can change the way children think and speak, you will create social change. Can you speak to that a little bit more? You'd mentioned something about talk therapy. I know they call it conversion therapy, but talk therapy, and I think, like, to answer one of your questions, like, what can we individually do, is just, I think we can't participate in the terminology.
Sure. Yeah. If we could get a handle, if we could talk about this issue in our own language, in the language that's very basic and simple, transgender belief, embracing the body, embracing the reality of our bodies. Our bodies are good, just very simple language. Gender dysphoria, it's not that, I think we have to get away from their own language. Talk about it as body hatred. That is the most simple. And then love thy body. That is a beautiful, beautiful title, and it's a beautiful phrase. Because of how gender was warped, as much as I try to avoid the word, I try to always speak about sex. No, it's not a gender reveal party. It's a sex reveal party for your unborn child. That is something very small, but that is where all revolution begins. And the one thing that the conservative side is terrible at is language. We lose the battle because we concede the language, and that's what undergirds the entire war, is language. Correct, talk therapy. All psychotherapy is talk therapy. That's all it is. Conversion therapy is, there's no such thing. Conversion therapy was created by that term was created by homosexual activists. And they defined it as, they associated the term with electroshock therapy, ice baths, and all kinds of torture aversion therapies. And they claim that these were used to convert someone from homosexual to heterosexual. Now, first of all, those aversion therapies existed for everything way back in the 40s, the 50s, the 60s. Oh, you're alcoholic? Here, take this pill. It'll make you throw up the moment you have a drop of alcohol. Yeah, we're going to give you electroshock to break you of this, that, and the other thing. But since the 60s, that fell out of favor. So it was never associated with homosexuality alone. It was something in psychology, kind of like psychology used to champion lobotomies. So the message I try to get across is, again, I won't use the term conversion therapy. It's talk therapy, because guess what? Every psychotherapy is about change. I don't go to a counselor if I don't want to change something about myself. I want to renew my thinking, change my behavior. We talk about it as change, as growth. So the term conversion therapy, again, was simply to get a negative connotation and disparage those who help people with same-sex attraction to embrace their bodies. We're embracing the natural function of their bodies. Yeah.
Okay, thank you so much for those questions. Another round of applause. Amber Vibetto is going to be giving next steps for the conference.